speaker. Our next speaker would be Dr. Pranita. Yeah. So Dr. Pranita is now associated with the All India Institute of Medical Sciences. She is a prolific examination giver, and along with her husband, Dr. Devesh. And she's also very keen on ophthalmic education. So we invite her to talk to us about the ICO, FAICO, and subspecialty fellowship examinations.
Thank you, Dr. Devendra, for that kind introduction. So I'm Dr. Pranita, and I'm talking about FICO, FAICO, and the subspecialty exams. I think these are one of the most popular exams, especially in the Indian setup, that the students are appearing for. So once you enter the post-graduation, life seems to be all set, because from MBBS, clearing and getting an PG seat, and especially a surgical branch, it seems like that is it. Nothing more is needed. But just a couple of months and you realize that that's not it, you need to do more, and then you need to decide what you need to do, whether you want to stay in India, because the opportunities for good fellowships or good senior residency where you get a good surgical exposure is limited. So that is when you start thinking about whether you want to go abroad, do a fellowship there, and which exam do you want to go for, which certification course is going to give you that extra edge over and above your peers. So we have a lot of international exams that we'll be covering up today. I'll be talking about ICO. The International College of Ophthalmology, it consists of various steps of exam. So the steps are 4 steps basically. The part A is visual sciences, part B is optics, refraction and instruments, part C is clinical ophthalmology, and the final step is advanced examination. Unlike other exams, you can appear for both part A and part B together in the same sitting as well. Together, the part A, B and C are known as the standard examination. And once you have cleared the standard examination, that is the first 3 steps, there is an advantage that you can also become eligible for the final step of FRCS Glasgow, which is the final clinical exams or the Viva practical exams. So that's the advantage with the ICO. It also allows you to appear for the FRCS. However, you need to understand the FRC Opht is completely separate. You do not get any such exemptions from the ICO exam for the FRC Opht. Once you clear the advanced examination, you have the advantage of not just using the post-nominal acronym of being an FICO, but other advantages that we'll be discussing subsequently. So the part A, visual sciences, tests your basic knowledge of anatomy and physiology, all that you read about as soon as you enter your post-graduation. But in addition to that, it also assesses your knowledge of neuroanatomy, epidemiology, statistics, pathology and microbiology. So you need a basic knowledge of your MBBS as well when you're appearing for this first step. This is an MCQ based exam. A total of 120 questions are there. And it's a four options. You need to select the single best answer. No negative marking, a 3-hour exam. And what you need to read is the basics of AIOS series, Anatomy and Physiology of Corona. And even the book by John Ferries is very helpful. It's a self-assessment kind of book in a question-answer format, which you can read for the Part A and Visual Sciences. And you get a certificate in the end once you complete this exam, which can be the passed with merit, or passed with distinction. The next part is part B, which deals with optics, refractions and instruments. And this is also an MCQ based exam, 60 MCQs, no negative marking, a 1.5-hour test, which you can club with the part A as well. And a book by the Clinical Optics by Elkington, the Chua Optics, Duke Elder, and Optics and Refraction by Khurana is good enough to clear or crack this exam. Again, these 3 certificates, you can pass with these 3 certificates. The next step is clinical ophthalmology examination, which tests your entire knowledge of ophthalmology, something similar to your final postgraduate exam. Just the difference that this is not a theory exam. Again, it's an MCQ based exam, 200 questions, no negative marking, a 4-hour test. So the book by Kansky's Clinical Ophthalmology and American Academy of Ophthalmology are good enough because the questions are mostly on to basics. It is not something based on advanced research, but basic of ophthalmology and the entire subject of ophthalmology is what is going to be tested in this step. The final step is advanced examination, in which it is more of the practical application of the theoretical knowledge that you have read about for your post graduation is what is tested. Again, it's an MCQ based test, but you also have extended matching questions in which you may have a case scenario, and on that base case scenario you may have 3 to 4 subsequent questions. So you have to be able to identify that particular clinical diagnosis to be able to answer all those subsequent steps correctly. There is no negative marking again in this one, and total time is 3 years. And the books that we just discussed in the clinical sciences is again good enough for advanced examination, but with a more practical approach. So when to appear is an important decision because you don't want to waste time. There are 4 steps. Obviously, you're going to appear one after the other. So for the part A, immediately as you enter the post-graduation, it is good enough to appear for this test because you're fresh with your MBBS knowledge, which is also a part of this step that will be tested. The second step by the end of your first or second year. The third step by the end of your post-graduation. And advanced is best after you have completed your practical exams of your post-graduation. This is the website from ICO, which gives you details of all the centers. You have a lot of coordinators from India as well who are coordinating these exams, and you can contact all these exam coordinators. The dates are updated on the website time to time. They are conducted every 6 to 8 months. The next exam is going to be conducted next month, the date for which is already closed for application. So you can watch out the website for the next coming date. And again, the cost is something very important. Every step is expensive. A total of 1.5 lakh is what we are looking at if you are going to appear for all the 4 steps. And the exemptions we have already discussed. If you complete all the 3 steps, the first 3 steps, that is a standard examination, you can directly go for the FRCS final step. The other advantage is it does give you an opportunity for short and long-term fellowships abroad. So these are basically fellowships with scholarships that comes, which is advertised on the website also. You can have a 3-month or a 1-year long fellowship. With a 3-month fellowship, there is an incentive of around $6,000 to take care of the expenses, your travels for the fellowship. These are the various specialties in which the fellowships are offered, and you have a detailed list of all the international hospitals and medical colleges which provide fellowships in particular subspecialties as well, which you can look into when you are applying. Now that was about ICO, something about the subspecialty exams. So nowadays, just doing a fellowship into a subspecialty may not be enough because that does not add on to your actual affiliation, right? And whenever the patients come to you, you have a post-graduation degree, you may have done a fellowship in 3 years. For example, I was in practice and one of the patients came and he said, you are a cornea specialist, but there is nothing to add to your name in the degree. So you need to justify even a fellowship that you have done, which you can justify with these subspecialty exams, which you can add as an acronym to your name. So the All India Association of Ophthalmology has come up with this subspecialty exam, which they are running for almost 10 years now. And they are one of the cheapest fellowship exams all across the globe, at which comes at just a cost of 10,000 rupees for each exam that you appear for. Okay, so these are the subjects in which you can appear. And at one time, you can appear for only 1 course. And at maximum, a candidate can appear for 2 subspecialty exams. This is again an MCQ based exam, a 1 hour 60 MCQs. That's the first step. If you clear that, the second step is your practical viva, wherein again you have 2 parts. One is the OSCE, in which you have 10 OSCE questions based on clinical condition, clinical pictures, scenarios, and then you ask questions on that. And you also have a separate viva on it. Once you clear both the steps, that is when you get the FAICO fellowship. So as I told you, it is just at a cost of 10,000, but you need to be an AIOS member. You need to have a basic post-graduation qualification in ophthalmology, minimum 2 years of experience post-graduation, and minimum 18 months of exposure into the particular subspecialty that you are trying to appear for. Even if you do not have that, even a 3-year practical work experience, even in your practice, is good enough for allowing you to appear for this exam. So it's a long roadway, multiple steps. So plan well in advance because you don't want to waste time as well as money for it. And there are limited seats, limited slots that come up for these exams. So plan well ahead in advance. And I'm sure you're going to do well. With that, I would like to end. Thank you.
Thank you, Dr.